guys, it's Kati Kleber here, sitting here with Hannah and Tosh, and we're just hanging out, and I thought I'd do a quick video to tell you, go over something that I thought might be kind of helpful for nursing students to know. Something that's frequently used in the hospital on patients is something called an order set. So what's an order set? It is, and I actually went online and I printed one off. I just Googled stroke order set and printed off the first one I found. So basically anyone that gets admitted with specific diagnoses, a lot of hospitals will utilize order sets. It says, hey, you know, for the best practice, anyone that gets admitted with a stroke without TPA needs these orders. And there's another order set for people that get admitted, with a stroke with TPA, or a hemorrhagic stroke, or congestive heart failure, or this or this or this. So that a lot of orders, you have all the orders that you need as a nurse. The patient has everything that they need. Procedures that are best practice are ordered, and it's not like the physician, the nurse practitioner, or the PA have to like try and remember, oh wait, what do I have to give for this and this and this, and you know, maybe they get all the big things, but maybe they forget a diet order or an activity order, or maybe the patient's NPO and they, you know, maybe they should have some fluids, like that kind of stuff. So it cuts down a lot on the calls, yes, and it cuts down on kind of just forgetting some stuff. So they're wonderful. So like this one, it's 7 pages long. You know, it starts off with, you know, where's the patient going to be admitted? This is the attending physician. This is their diagnosis, their code status. This is how often I want vitals taken. Notify the physician. Take the vital signs every 4 hours. Notify if the blood pressure is greater than 220 systolic. You know, get their weight on admission, INOs, activity levels, allergies, nursing orders. I mean, they're pretty comprehensive. And if you try to think of how many stroke patients get admitted, and if they would have to just like come up with all these every single time, that's a lot of work, right, Tosh? It's a lot of work. And it's a lot of opportunity to forget stuff. So I think they're wonderful. But the only kind of like limitation I think of order sets is, you know, you kind of get used to them, and maybe, you know, and patients are not cookie cutters, right? These order sets are effective for like 80% of patients, but you know, 20% of patients, they're not everything in them is the most appropriate, if that makes sense, right, Hannah? So that's what's one of the things to know. And it's not like one patient will only have one order set. Like, you know, a patient could have a stroke order set and a central line order set, like to make sure they have all the appropriate flushes. And maybe they'll have enteral feedings, and they'll have the enteral feeding order set. And you'll have all these specific orders. And, you know, patients aren't cookie cutter. So, you know, they could only have some that are applicable, and you have to really figure out which ones are applicable to this patient, which ones we don't need. But they're wonderful, and I really like them. But, you know, it does have limitations in that people kind of start to think in order sets and kind of rely on them to think that everything is there or that everything is appropriate. Like I got a good example. My father-in-law was a while ago admitted a long time ago for a stroke, an ischemic stroke. He had one in his posterior circulation, not a TPA candidate, and it was a rather large ischemic stroke. And my sister-in-law, Elizabeth, she was on the blog not too long ago for going on a medical mission, so check her out. She's actually a nurse practitioner. But he, that night, he got admitted, and they went to give him sub-Q heparin. And, you know, being the nurse questioning, you know, practice with a questioning attitude, right? She was like, hey, should he be getting... I'm just curious if this was cleared with a neurologist for him to have sub-Q heparin with a large stroke in the posterior circulation. And the nurse was like, oh, I don't know. Let me go check. And so she called, and actually the neurologist was like, actually, yeah, the risk for hemorrhagic conversion is much higher with him. Or, you know, I didn't want him to start him to be on sub-Q heparin yet. But it was part of the order set, and the hospitalist had filled out the order set. And so, you know, it's like, oh, well, every stroke patient needs chemical DVT prophylaxis. Let's give him, you know, 5,000 units of sub-Q heparin, Q8 hours. Well, for him, that wasn't appropriate. He also, what's also on a stroke order set is statin medications, and he had cholesterol well within normal limits, and they were putting him on a rather hefty dose of a statin medication, and he's like, this stroke was not because of cholesterol, it was actually because of a clot on his mechanical valve. So why am I being started on, so it's like, it's not like a cookie cutter kind of thing. So it's something to keep in mind that you want to, while the order sets are awesome, you also want to make sure that you're using your critical thinking when you're looking at the orders that are included and maybe some that may be omitted. So the physician and their support staff will fill them out, and then us as nurses, it's our job to go through and make sure everything's on there that we need and that there aren't things on there that we don't need. So that is me and Hannah's explanation of what an order set is.